My name is Katie. I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask me any questions you might have.
Thank you so much. I look forward to learning a lot. So you're taking care of the patient in room 622. Do you have time to give me a report?
Sure. So this is patient Ronald Jarvis. He's in room 622. He is a 67-year-old male with a 20-year history of type 1 diabetes mellitus. He has no known allergies, and the client status is a full code. He weighs 171 pounds and is 5'11". The patient was admitted to the hospital with a chief complaint of a non-healing wound on the right heel and high blood glucose readings for the past 5 days, consistently in the 300s. Today we will be administering insulin glargine, 18 units subcutaneously, which is given daily at bedtime. His primary diagnosis is stage 2 diabetic ulcer on the right heel, and his secondary is diabetes mellitus type 1. He has a history of hypertension, severe visual impairment, so therefore he wears glasses, a history of high cholesterol, and controls his diabetes with insulin, and he is compliant with the diabetic regimen. He also has a history of benign prostate hypertrophy and neuropathy. He has had a transurethral prostate resection about 5 years ago. The patient admits to tingling in bilateral lower extremities, which has seemed to worsen in the past 3 months. His father died of an MI at age 53, and his mother died of lung cancer at age 78. His vital signs are 98.4 for his temperature. His respirations were 16, pulse was 76. His blood pressure was 128/70, and he had an O2 saturation of 96. His respiration pattern is even and effortless. His pain is at a 1 out of 10 after the administration of morphine, and is resting comfortably. The patient's IV site in the right median vein forearm shows no signs of phlebitis or infiltration. At 15:50 on Tuesday, his urine output was 220 milliliters, and his weight remains at 171 pounds. His last glucose reading was 242 milligrams per deciliter at 20:30, and his last meal was 4 hours ago, and insulin was given per order. The client has a wound on his right heel lateral aspect, and it is considered stage 2 pressure ulcer, which has partial thickness loss or dermis presenting a shallow open ulcer or intact fluid-filled blister. The wound is 5.5 centimeters and 2.5 centimeters and about 3 centimeters deep into the dermis. The wound's base is pink with moderate serosanguinous exudate. His bowel sounds are present in all 4 quadrants. Some recommendations are to admit the patient in the medical unit for glucose control, diabetic teaching, pain management, and wound evaluation and care. Also, to consult the wound care nurse. And then one last recommendation would be to teach the patient about the 1800 American Diabetic Association diet, because he would like some education on this.
And then you asked one more.
The patient has medication, insulin glargine, due soon.
Thank you so much for giving me a report. Do you mind if I ask you a couple of questions regarding the medication administration, then watch you demonstrate giving the medication in the patient's room?
Not a problem at all. What questions do you have?
Why specifically is the client receiving this medication?
The patient is receiving this medication because he has type 1 diabetes. And what this means is he's not producing his own insulin, so we have to give him insulin, and we especially need to be giving him this medication, insulin, to lower his blood glucose levels because they've been in the 300s.
And what action does the medication have on the body?
What this action has on the body is it decreases blood glucose levels by causing the blood glucose to be taken into skeletal muscle and fat tissue, and it also prevents the liver from producing glucose.
Good. And what should you question administering this medication, or when should you question administering this medication?
I would question giving this medication if the patient didn't have any food in front of him, or at least a snack. I would also question it if he's unfamiliar with the medication, if it's not looking right, if something's just not right to him. And then also if his blood glucose levels are below 70, because we want it to be in a range of 70 to 120 to prevent hypoglycemia from occurring. And if he has any allergies to it, hypersensitivity to it, if the 5 rights aren't correct, so the right time, the right dose, the right amount, the right medication to the right patient, we want to make sure we're looking at all of that before giving this medication.
And does this medication have a therapeutic serum level?
No, this medication does not have a therapeutic serum level because we actually make insulin, but ways to see how this medication is working effectively is to measure the patient's glucose levels. We want to make sure it's at 70 to 120, and maybe looking at their A1C levels is a good idea as well.
What vital signs must be monitored?
Some vital signs, I would take a baseline of all vital signs, and I would also get information on his weight, because if that changes, then also the amount of insulin we use can also change.
What physiological parameters should be monitored when the medication is being administered?
Some things I would want to look at when I see the patient is if he looks like he's having any hypoglycemia reactions. So if the patient looks pale, he has cool skin, he feels nauseated, tired, weak, if he even has hyperglycemia effects, we want to look at everything like that before we give it. And even labs, it's good to look at the glucose readings and yeah, just the vital signs.
Good. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
In the hospital setting, I want to make sure I tell the patient the different side effects of hypoglycemia, what signs and symptoms to look for, so that way they can tell me, hit their call light whenever they first start seeing these, because it can be very bad. And also I want to make sure that they know that when I give them the food, it's important that they eat, because then that can cause even more problems.
And what interventions must be taught for taking the medication safely at home?
At home, I would teach the patient that since this is a long-acting insulin, we give it once a day. So it's really important to be taking it at the same time every day in order to keep his blood glucose levels steady at all times. I want to make sure that he keeps his insulin out of sunlight. I want to make sure he's altering the sites of injection, so from the abdomen to the arm to the thigh to the buttocks, and to stay in that site for at least a week before moving on to the next. Also, it's important to wear their medical bracelets, telling us that, or anyone who might see them at a time of crisis, that they have diabetes, so we can do what we got to do. And then also, it's important for them to carry a 15-gram carb just in case they do have a hypoglycemic reaction to prevent that.
Good. What are the side effects and potential adverse reactions?
Sorry. Some adverse reactions would be is that going to die?
It has 10% battery left.
Okay. Some adverse reactions with this medication could be lipodystrophy, hypoglycemia, arrhythmia at the site, itching, what else? Yeah, those are some few that you could see from this medication.
Thank you. How will you know the medication is effective?
I'll know if it is effective is if their blood glucose level, if his blood glucose level goes down to a good range, and if he's not experiencing any side effects to this medication, and yeah.
Good. Any more questions for me before we go in and administer the patient their medication?
Nope.
Okay.
you want to plug that in? I don't mind. I don't want it to
Yeah,
die.
I'm gonna go plug the computer in.
The computer is dying, so we need to put it in the charger. Is there one near? Or no?
You can just do the medication administration.
Oh, okay. I'll turn it towards me. Alright, so I'm going to go into the MAR.
Pull it.
Good.
Oh, I hit myself.
How do you go in? Oh, here. Alright. So we're going to go into the MAR.
There we go.
And we're going to be giving insulin glargine, which is a long-acting insulin. And we're going to give it once. It says daily at bedtime, so that's when he must be getting his insulin every day. So we want to keep that same time every day to keep his glucose at a good level. We're going to be giving 18 units subcutaneously. So let's pull this out. Alright, we have it. So I'm going to do my first check. And I have insulin glargine, and it says insulin glargine. We're going to be giving 18 units subcutaneously in the abdomen. It's daily at bedtime, so we're going to give it for the first time today. And it's going to be at 22 o'clock on Tuesday to Jarvis, Ronald Jarvis. So everything looks good. I'm just going to wash my hands. I'm going to put some gloves on. All right. So first, I'm going to clean the top of the vial. And we're going to be doing 18 units, so I'm going to take in 18 units of air. It's going to turn on. All right. And I got the air. The vial's cleaned. Put in my air. Now I'm going to take out 18 units of insulin glargine. Alright. And if it would stop rolling off the paper, I'm good. I'm going to do the one-handed recapping, and what this does is it prevents you from getting stuck from the stick from the insulin. All right.
Thank you.
I'm going to take these off. Wash my hands. All right. I'm going to do my second check for the medication pass. I'm going to check it against the doctor's orders or the orders. So we have our insulin here. Insulin glargine, 18 units, so we have 18 units. Subcutaneously in the abdomen is where we're going to be giving it. Once daily at bedtime to Ronald Jarvis, Tuesday at 22 o'clock. So everything looked right. All right, and we're going to head on into the room. I'm going to knock. Sorry, I'm going to knock first. All right. Hello. My name is Maria, and this is Katie. We're going to be your nurses for today.
Okay.
First thing is that I have your little snack here for you.
Oh, thank you.
Because we're going to be giving you insulin today. Could you tell me your first and last name and date of birth?
Oh wait, just kidding. Jarvis, Ronald, March 25th.
And the year?
Yeah, 1993.
Okay. And then, do you have any allergies?
No.
No allergies. All
No
right.
allergies.
Just double checking. All right.
Okay, that's cool.
Okay. So today, I'm gonna wash my hands. Today, what we're gonna be doing is we're gonna be giving you your insulin. Do you know why you're getting this insulin?
Yeah, for my diabetes.
Do you know what type you have?
I think 1.
Okay, yeah, you have 1. Do you know like what that means? When
No.
you have type, okay. What type 1 diabetes is, it means that your pancreas isn't making insulin. So we have to give you the insulin in order to get the glucose, which is like energy, into your cell. So it's not like, so you don't feel tired, like, and weak. It gives you energy. So this medication is really gonna help you.
Yeah, that's important.
But before I give this medication, I want to tell you some side effects that you can see with insulin. It can decrease your blood sugars if things don't work out too great. Do you know some side effects of this medication? Do you know what you would see if your blood sugars are low?
Well, like you just said, I feel weak.
Yeah. Okay, well, also you're going to get like pale. Your skin's going to be cool to touch. You might feel like nausea and tired and weak and like shaky. So if you feel any of that, you really need to make sure you call me, okay?
Okay.
And I also want to make sure you're eating your snack
Oh, okay.
while I'm getting everything ready over here. Alright. So I'm going to
This is good.
scan my patient. That's good. ID. Alright. I'm going to scan the medication. If it works. Oh, cool. Oh, whoops. I'm going to have to scan your ID again. Sorry about that. Yay. Alright. And I'm going to do my third check with my medication. Before I do that, I want to make sure I provide for privacy because that's important. Also, alright, so I have my insulin here. It is 18 units of insulin glargine. We're going to be giving it subcutaneously in the abdomen, and it is Tuesday at 22 o'clock, and we're giving it to Ronald Jarvis. Also, Ronald, before I complete my documenting later on that we're going to do it in the abdomen, I want to make sure that that's okay with you, that site. Is that site all right with you? Did you use it at all recently?
Yeah.
You did? Okay. Did you use it, like, when did you use it? How many times about?
Just once.
Okay, that's good. So we'll just keep using that site then in the abdomen, and I'll just do it like an inch away from where you did do it last.
Okay.
Because it's important to prevent like using the same exact site, because what that can do is it can cause a breakdown of your fat. So you have lipodystrophy, that's what that is called. And it's really bad because even though you're giving yourself the insulin, you're not really like absorbing it, which means you could have low blood sugar, what kind of side effects did I tell you you'll see from that?
You said pale skin, weakness, cool skin, and nausea.
Good, that's awesome. All right. So I'm just going to continue with my medication class then. I'm going to put on some gloves. How's that bar tasting?
It's good.
Good.
Good snack.
Yeah, it is. And it's also sugar-free, which is good for diabetics. I know you had some questions about like a diet. You were doing the 1800 diabetic diet, correct? But you said you kind of forgot some things about it.
Yeah.
Okay. Well, what you can do for that is you could eat less fats and decrease your saturated fats, your trans fats, increase like fruits and vegetables, and just low sugars too.
Okay.
Okay? Alright, so I'm going to clean the side. I'm just going to lift up your shirt a little bit, and I'm going to clean your abdomen with this alcohol. I'm going to let it dry. And I'm going to pinch the skin and inject the insulin. Alright, I'm going to put it straight into the shots container. You doing okay?
Yeah.
Everything alright? Okay. Just going to take off my glove. And I administered this at 22:05. And I'm going to put my initials in the palm, in the abdomen. Sorry, just a second. Alright, so then I'm going to wash my hands, and I just wanted to make sure I teach you a few things. Like I said, if you see any of those signs of hypoglycemia, make sure you call me right away, and I'll bring in one more snack right over here, just in case you do feel anything at all, those signs of a low blood sugar. I want to make sure you have something to eat, and then make sure you also just call me right away so I can take care of that. You can check your, and then also I'm going to come in and check your blood glucose levels again in about 6 hours. And even in between that time, though, I'll be making sure that you're doing okay. So it all depends on how you're feeling. Also, I taught you about the different sites, right? Do you know other sites other than your abdomen area?
Maybe my arm?
Yeah, you could do your arm, your thigh, and your buttocks area. But your abdomen's the best place the fastest place of absorption. But that doesn't mean you should always do it there. You should stay in that region for about a week. And then it's really important that you move on to another site, like your arm.
Okay.
Okay? And don't forget that this is a long-acting insulin. So it's you actually don't see hypoglycemia as much with this type of insulin because it's really steady. There's no peak. So just and then also to remember to take it once a day at the same time when you're at home.
Okay.
We just took it at night, and it's 22 o'clock. So I want you to do that every night. Okay?
Okay.
Same time. Alright. So then I'm going to document my teaching. I'm going to document the site of injection where I did the medication, where I put in the insulin, and then I'm also going to put in what type of things I assessed, like her vital signs, her labs, her glucose levels. I'm also going to document her things that I did. I gave the patient her food before her medication. I also gave her her injection. I taught her multiple things, and I'm going to document the time of the medication and all of that. Alright, so we're good then. Do you need anything else? I'm going to give you your call light.
Okay.
So here it is.
Thanks.
And make sure you let me know if you feel anything at all, alright? Because I'm here for you.
Alright, awesome.
And this is your extra food.
snack.
Alright.
Okay, I'm eating.
Oh, it's charged anyways. Alright, I'm going to provide for privacy.
Thank you so much for demonstrating a safe medication administration. I just have a couple more questions for you if you don't mind.
Sure.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I checked the patient's glucose levels, and it definitely needed it. It was in the 200s. And also I looked for any signs of hypoglycemia, because if there were any, then we wouldn't want to give the medication, or else it would make his blood sugar drop even more and could cause some serious problems. Also, I checked his electrolytes in labs, his CBCs, all his electrolytes, because it can especially affect potassium as well going into the cell, which means you'll have low potassium in your blood.
Did this information affect your decision to administer the medication?
Say that again? Sorry, I was trying to...
Yeah. Did this information affect your decision to administer the medication?
No, yes, it did, because the glucose was high. I wanted to make sure I gave the insulin, and the fact that she had her food with her, her snack, that means I could also give her medication, and yeah.
And did this information affect how you administered the medication?
No, it did not. Well, actually it did, because her glucose, or his glucose, was so high. I wanted to make sure to give it in the abdomen, and also because he said that he already had his last injection in his abdomen only once. We wanted to make sure to stay in that site for about a week, because it allows for the best absorption when you stay in the same site.
Good. Thank you so much for answering all of my questions. I really feel like I understand this so much better.
Again, not a problem at all. I'm always here if you have any questions or need anything. I'm going to take some time now and document the teaching I provided to the patient and any other things I did in the patient's room. Do you want to observe me documenting as well?
Sure, I would love to watch.
All right.